Oh, hi there, everyone. Linda here from Just for Tummies. Now, over the years, I've, being an ex-colon hydrotherapist and, having carried out thousands and thousands, tens of thousands of colon hydrotherapy treatments, I've obviously come across a lot of people who find it difficult to have a poo when it's not in their own toilet. So what they do, they ignore the urge to empty their bowel. And if you do this frequently for many, many years, it can cause problems. It can increase your risk of getting diverticular disease, especially in the sigmoid rectal area of your colon, that bit on the left-hand side down at the bottom. And of course, if you're getting chronically constipated, it can also increase your risk of getting bowel cancer. So I always urge people that if they have the urge to go, try and get over that hurdle of using a strange toilet. I mean, if necessary, in your bag, just carry some wipes so that you can give the toilet seat and the toilet handle, a good wipe before you use it. But just understand that ignoring the urge to go can be dangerous. But today, I just want to talk a little bit about a baggy bladder, because this can be caused by ignoring the urge to empty your bladder. So recently, a lady contacted me and explained that she had what is sometimes known as nurses bladder. And they sometimes call it nurses bladder because nurses notoriously, due to the nature of their job and the pressure that they are under, they just ignore the urge to empty their bladder. And this can increase their risk of getting urinary tract infections. And this particular lady, because she developed a baggy bladder, she wasn't able to empty her bladder normally. It wasn't able to contract, to expel urine. So she now has to self-catheterize. And if you don't know what self-catheterization is, it's where you insert a very slim tube up your urethra to empty the urine that's building up in your bladder. Because the longer the urine is in your bladder, the more susceptible you're going to be at getting urinary tract infections. Because the longer the urine is in your bladder, the more likely the E. coli is the bacteria that's responsible for most UTIs. So the more likely the E. coli bacteria will be proliferating in your urine. So it's very important to get rid of that urine. But of course, introducing a foreign object into your urethra, like a catheter, although they're sterilized, can also introduce bacteria into your urethra, into your bladder, and trigger a urinary tract infection. So these women are very often stuck between a rock and a hard place when they're having to self-catheterize. So I just want to, remind you not to ignore the urge to go, whether it is to empty your bowel or to empty your bladder. And if you are living with debilitating urinary tract infections, then don't forget that my For Women probiotic capsules that I developed specifically for women who suffer with UTIs, thrush and bacterial vaginosis are still on offer until the end of this month, 10% off. So that's all I've got to say for now. If you've got any questions about bowel issues, in particular constipation, irritable bowel syndrome, diverticular disease. I think people who have diverticular disease and the diverticulitis flare-ups are very poorly served in primary care. They're not given enough information to help manage their condition and prevent the diverticulitis flare-ups. And diverticular disease is a very common disease that affects the large bowel in particular, and in particular the left side of the large bowel, that sigmoid rectum area. It's very common, especially as we age, when we get over the age of 60, 70, and it should be a relatively benign condition. The problem is, if material gets trapped in the diverticular pocket, then it can trigger an infection like diverticulitis, and that usually means antibiotics. So many people who suffer with diverticular disease and they're having these constant flare-ups of diverticulitis are just on the merry-go-round of a diverticulitis flare-up, antibiotics. A few months later, another diverticulitis flare-up, another course of antibiotics. And it's just like I was speaking to you a few days ago about urinary tract infections, a UTI, antibiotics. A few weeks later, another UTI, another course of antibiotics, and on it goes until many of these people end up with antimicrobial resistance or antibiotic resistance, and we can intervene. We can stop that if people have the right information, the right products on how to manage, whether it be their UTIs or their diverticular disease, then they won't be getting these constant flare-ups that can be very debilitating, massively impact quality of life, and push them towards antibiotic resistance. So yes, I just want to say, if you have any of these conditions and you need help and support, then don't hesitate to contact Just for Tummies. Hi Linda, Facebook user. That's obviously somebody on Tummy Talk. Kay. Oh, hi Kay. Kay, if you don't mind, Kay, I'm just going to pop your question up on the screen. Right, Kay. Hi Linda, I have a client who gets repeated UTIs. Which of your products would you recommend? She's perimenopausal too. So Kay, you probably know this, being a practitioner yourself, a reflexologist, I believe, that women whose hormones begin to change due to the menopause are more at risk of getting not just digestive and gut problems like bloating, trapped painful gas and constipation, but they're also more at risk of getting urinary tract infections. And I recommend all women who are perimenopausal, menopausal, who are beginning to get UTIs, to immediately start taking my For Women probiotic capsules, one before breakfast and one before bed, and to also take some antioxidants. So also take one of our Just for Tummies high strength odor controlled garlic tablets and one of our omega-3 high strength fish oil capsules. So that would be my advice. And Kay, I don't know if you know, but on the Just for Tummies website, in the navigation bar at the top where it states free advice, if you click on there, or if your client clicks on there, she can download my free UTI fact sheet. And there's lots of dietary and lifestyle tips and advice in the fact sheet. But the reason I developed my For Women probiotic capsule, I don't know if you know the story, and I touched on this in the live event I did last week with Sophia, our nutritional therapist. The reason I developed the For Women capsules was because one day when I was still working in the clinic, I had a lady in who'd come to see me for colon hydrotherapy. She'd been recommended to me by her gastroenterologist at Queen's Medical. And this lady suffered with chronic constipation. And they tried everything to empty her bowel. They tried laxatives. I mean, she'd obviously tried diet and changing her lifestyle. But this lady had a severely hypotonic, lazy bowel and suffered with chronic constipation issues and had done for years. So they tried everything, including the strongest laxatives and enemas, and nothing was shifting the impacted feces in her bowel. So they referred her to me for colon hydrotherapy. And I was able to give her a great deal of relief by administering a couple of colon hydrotherapy treatments. But one thing that puzzled me was when someone gets as badly impacted as that in their bowel, they normally, at hospital, they normally admit them and they carry out a procedure called manual bowel evacuation. And this procedure is administered under anaesthetic, and it's where they literally glove up in the theatre and they put their hands up your back passage and they pull the feces out. Now, the issue with this, as you can probably imagine, is that there's a high risk of getting an infection with such a procedure. So, and that's when antibiotics would be prescribed. But this particular lady who came to see me, they couldn't prescribe any antibiotics because she'd become antibiotic resistant. And so I was intrigued as to why she'd become antibiotic resistant. And then she went on to tell me that for decades she suffered with urinary tract infections, and each time she had a UTI, she was prescribed another course of antibiotics. And as we know, antibiotics, broad spectrum antibiotics, are indiscriminate. They will hopefully kill the bacteria in the bladder that's causing the UTI, but they will kill billions of the bacteria in your gut, on your skin, in your lungs, everywhere. Wherever there's bacteria in the body, the antibiotics will have a detrimental impact. And I remember thinking at the time, and I remember feeling really angry that this poor woman had for years suffered with UTIs, and every time she had a UTI, she was put on antibiotics, and it had put her in the position of being antibiotic resistant. And I thought, there's got to be another way. There's got to be an early intervention so that women like her, and I know there are thousands and thousands of women that suffer with recurring UTIs, so that women like her can be helped earlier. So these UTIs can be stopped in their tracks and managed properly. Because when it comes to orthodox medicine and primary care, many of these women, when they get a UTI, they just give them broad spectrum antibiotics anyway. It's rare that a culture is sent off to the lab to find out exactly what type of bug they're dealing with and what type of antibiotic they need. So they're just given a broad spectrum antibiotic, and they end up with another UTI a few weeks or a few months down the line, and then another course of antibiotics. So that's the reason I developed my For Women probiotic capsules. I'm getting to the point now. So I researched the particular strains of friendly bacteria that have been shown to help reduce urinary tract infections and incidentally thrush and bacterial vaginosis. And I put these strains in my For Women probiotic capsules. But of course, being a naturopath for 30 years and having thousands and thousands of women come through my clinic over the years, I realized that supplements like garlic, antioxidants like garlic and omega-3 can also help in preventing recurring UTIs. So that's the story behind why I developed my For Women capsules. Thanks very much, Kate. Yes, please direct your client to the Just for Tummies website. Hi there, Sarah. So, okay, that's interesting then. So that's what happened with your client, repeated antibiotic prescriptions. Honestly, Kate, it just makes me so angry that there's no early intervention. There's no information or awareness to help these women so that they understand exactly what's happening to their bodies, what's happening to their bladders, why it's happening, and education around how to prevent the antibiotics. Every time they get a UTI, they just put on antibiotics, and I've seen this so often over the years, and not just with UTIs, of course, but as I was saying earlier, with diverticular disease. Every time someone gets an attack of diverticulitis, they put on antibiotics, and of course they need to go on the antibiotics just like you do when you get a UTI, because by then it's a bit too late. You've got an infection, you need the antibiotics. But I'm trying to intervene, trying to get in early, and I certainly want to educate younger women who are getting UTIs about what's happening to their body, what's happening to their bladders, why they are getting UTIs, and what they can do to stop them from reoccurring. Right, so that's it for now. I talked a little bit longer than I thought. So yes, Kate, it's absolutely totally scary. And Kate, it would be great to have a chat with you on Just for Tummies. We can do a live video if you like sometime, and you can explain, certainly when it comes to reflexology, what particular points on the feet help to support bladder health, or the general urological health of a woman. I mean, I'm a massive fan of reflexology. I had reflexology when I was in my early 30s, when I developed chronic fatigue syndrome and depression in my early 30s after a particularly nasty bout of viral tonsillitis. And I turned to reflexology to help me, and it was the most wonderful treatment, because reflexology, what a lot of people don't understand with reflexology, it's not just a great diagnostic tool, is it, Kate? It's great at picking up where the problems lie in the body, but it's also a treatment at the same time. So you're sort of getting two in one, aren't you? An absolutely fantastic therapy, and one that people need to know more about. Kate, I will message you. I'll send you a message on Messenger and we'll arrange something. Okay, we'll get together. Oh, early 30s, only a couple of years. Is this your client, Kay? Yes, she's only, yes, early 30s. So she definitely needs intervention now to stop her getting on that merry-go-round of UTI, antibiotics, another UTI, another course of antibiotics, and so on and so on. Right, so thanks very much. Thank you, Kay. Great to talk to you. And I'll send you a message in Messenger and we'll get together on a live in the not too distant future. I mean, I've got a live coming up on this Thursday where I'm going to be talking to a lady called Claire, who runs the lichen sclerosis and vulval cancer awareness group, and we're going to be talking about lichen sclerosis and how many women are often misdiagnosed as having thrush, which is bad news, because lichen sclerosis, if it's not properly diagnosed and not properly managed with treatment, it can turn into vulval cancer. So 7 o'clock on the Just for Tummies Facebook page this Thursday, we're going to be talking about that. And then next Tuesday, again on the Just for Tummies Facebook page at 8 o'clock, we are going to be talking about how to winterize your immune system. Oh, hi, Kate. Oh, yes, my experience of reflux, yes, in my early 30s. The lady I went to see, the reflexologist, Kate, she was also an aromatherapist. So when I went to see her, she gave me reflexology treatment, and then she, depending on what points she found on my feet and what areas needed treating, she blended aromatherapy oils, and she gave me an aromatherapy treatment afterwards, and it was just wonderful. It really got me through a particularly bad time in my life where I'd been super stressed. My immune system began to shut down. I picked up viral tonsillitis. I was still working through it instead of resting. I mean, I know better now, but then I went on to develop chronic fatigue syndrome and depression. So yes, reflexology and aromatherapy really helped pull me through. So yeah, thanks for listening, everyone. And so don't forget to join me this Thursday at 7 o'clock when I'll be going live talking about lichen sclerosis and vulval cancer. And that will end all the information that Just for Tummies has been giving out this month about urology. This month, September, is Urological Awareness Month. So my live on Thursday concludes all the information, advice and support that we've been giving to women about urological issues, including UTIs, of course. So hi, Susie. Great topics coming up. Looking forward to hearing those. Yeah, thanks very much, Susie. Hope you can join us this Thursday anyway. So bye for now, everyone, and thanks again.